When we talk about back pain, it has diverse etiologies. All of us tend to think about on the disc. It is one of the most common clinical symptom that patient comes across and they come to the OPD. Etiology of pain in back is very, very complex. It's combination of mechanical deformation of the thecal sac or the exiting or traversing nerve roots and presence of inflammation, which gives rise to inflammatory mediator response. Especially when the annulus ruptures and nucleus pulposus comes out, it creates a lot of inflammatory response adjoining the nerves. There are several causes of backache. We're going to cover disc disorders and a lot of disorders beyond disc which give rise to backache. Role of MR in backache is very, very revolutionary. Currently, it is the gold standard of imaging in most of the spinal pathologies, whether it is degenerative disc disorders, whether it is infection, whether it is tumors, or anything else. Understanding of anatomy is immensely important because it allows us as radiologists and spinal surgeons better understanding of pathologies as well as variants. The best example of that is spinal surgeries, which used to be very extensive. Typically 30 years back, for any spinal disorder, whether it was canal stenosis, whether it was fascial arthropathy, whether it was disc disorders, the treatment was wide laminectomy with facetectomy. With advent of MR and a lot of instrumentations which have changed in spinal surgeries over the last 3 decades, minimally invasive surgeries and interventions like facet injections, aspiration of cysts have become possible. Endoscopic surgery, especially in acute disc disorders, has become gold standard, and all that is because of our better understanding of anatomy using MRI. What we're going to do in next 25-30 minutes is quickly look at lumbar spine anatomy, degenerative